Hello, my name is Bill Perucchi, and I'd like to take this opportunity to welcome you to the Cardiology Fellowship Training Program sponsored by the University of Connecticut at Hartford Hospital. We wanted to create a brief video to show you our institution and to introduce you to it virtually. Over the next several minutes, you will hear about some of the rotations here from fellows who have recently experienced them.
Hi, my name is Shikazi Alvarez. I'm one of the second year cardiology fellows. I would like to talk to you a bit about our consult service. In our first year, we do 2 rotations, 2 months, and in the second year, we do 4 weeks of the rotation. In the third year, we do not do a consult service. This service is very busy, and that's very good in that it allows us to get exposure to a lot of diverse pathology, patient pathology. We're a large tertiary referral center, and that allows us to get a lot of exposure and a lot of patients. We have to incorporate a multidisciplinary approach and thinking to managing patients. So, in addition, we are a large center. We have close to 1,000 beds, and our ER is very busy as well. So the learning that you get is very robust and exciting. We have the ability as well to impart some of the knowledge that we gain to students as well as residents that rotate with us on the rotation. Finally, we get a lot of teaching from our faculty as we do bedside rounds and a lot of time tableside rounds, and we get to discuss patients and discuss pathophysiology of the patients that we take care of.
Hi, my name is Evan Schreier. I'm one of the second year cardiology fellows here at Hartford Hospital. I'm here to tell you all about the cardiac ICU rotation. So in the CICU, you will learn all about the treatment and management of cardiogenic shock. You will learn about the management of post-MI patients. You also use mechanical support devices and get familiar with things like intra-aortic balloon pumps, Impella devices, both VV and VA ECMO. You are also responsible for supervising and teaching residents in the CCU. You also perform bedside procedures, including the placement of Swan-Ganz catheters, transvenous pacers. You can use a mobile C-arm to get fluoroscopic guidance on those procedures. And you also have access to a bedside echo machine to help you with your bedside procedures and management of the patients.
Hi, my name is Seth Fakis. I'm one of the second year cardiology fellows at Hartford Hospital. I wanted to take some time to talk to you a little bit about the electrophysiology service. As fellows, we get the opportunity to round with the electrophysiology service for 2 months during our first year. During those 2 months, we get one-on-one experience with one of our 9 electrophysiologists working at Hartford Hospital. On a daily basis, we see around 15 to 20 consults, managing arrhythmias from atrial fibrillation to ventricular tachycardia. Additionally, as a second or third year, we have the opportunity for elective time in either the device clinic or the EP lab. In the device clinic, we get the opportunity to round with some of our device nurses on over 2,000 devices that they manage on a yearly basis. Additionally, in the electrophysiology lab, we have the opportunity to work in one of the 3 labs operating at Hartford Hospital, doing complex procedures from pacemakers, either single, dual, leadless pacemakers, to ICDs, which can be CRT. We also have the opportunity to scrub in during complex ablations, such as atrial fibrillation, SVT, or even VT, including epicardial ablations. As a testament to our electrophysiology experience at Hartford Hospital, several of our previous fellows have had the opportunity to go on and receive additional training from institutions including USC, Temple, and NYU. So we are looking forward to having you visit Hartford Hospital, and we are happy to answer any additional questions you have once you come here.
Hello everyone, I'm Sonal Pruthi. I'm one of the third year cardiology fellows at Hartford Hospital. Welcome to our program, and I'm very excited to tell you about our cath rotations since I'm going into intervention next year. So we have 5 cath labs here, and every fellow spends about 4 months doing cath rotations in their first and second year. I think it is a great learning experience whether you want to do intervention or not. We have the state-of-art technology. We do a lot of image-guided PCIs, IVUS, and OCTs, which is the current recommended method to learn during your fellowship. And if you do decide to go into intervention, you see a whole variety of cases, including simple diagnostics to complex PCIs, left mains, bifurcations, and atherectomies. And the attendings are very supportive and very helpful during your whole application and learning process.
I'm Maggie Stevenson. I'm one of the third-year cardiology fellows here. Just want to give you a little overview of our rotations through the echocardiography lab here. So it's something that spans all 3 years of our fellowship. We do 2 4-week blocks in each of your 3 years as kind of the minimum, of course with the option to add on more in elective time, such that you're able to achieve the COCATS level 3 training in echocardiography if that's what you so choose to do. The way our lab time is structured is very much to kind of allow you to evolve through the process of reading and interpreting all kinds of echoes. So it starts in first year with scanning. So we work alongside the echo techs and our attendings. We learn how to scan independently such that we get called in the middle of the night to do a stat echo, and we're able to perform those pretty independently. And then we learn to read alongside our echocardiography attendings. So by the end of the first year, you have a pretty good level of independence with transthoracic echocardiograms. In the second year, we move on to doing more transesophageal echocardiograms, including structural echoes. So we're in the lab and in the hybrid ORs doing TAVRs, PFO closures, ASD closures. We do left atrial appendage closures, all those sorts of things. So we're able to participate in the TEE portion of those. We also do stress echoes. So we are able to run independently a stress echo and an exercise echo and a dopamine stress echo by the time we're done with second and third year. The volume here and diversity of cases is excellent. You see kind of anything and everything you would hope to see during your training. Our team of attendings, we have a whole dedicated non-invasive staff who are very dedicated to our education and learning and spending time with us, kind of achieving mastery in reading echoes.
Hi, my name is Verity Ramirez. I'm one of the third-year fellows here at Hartford, and I'm going to tell you a little bit about our stress and nuclear rotation. So kind of big overview, we have a really busy stress lab here, kind of ranging from patients that will just do exercising, as well as those that we also will take pictures of. So we do probably 10 to 15 stress cases a day. In terms of the nuclear cameras that we have here, we have 2 SPECT cameras and 1 PET camera. So that allows us to do perfusion imaging, as well as with the PET camera, we're able to do viability and sarcoid studies as well. In addition, we also do the PYP scans for amyloidosis. So it's a pretty kind of extensive range of pathology that we're able to see in our lab. In addition, when it comes to reading the images, we have, it's really focused on education. We do all the pre-reads, but all of the final reading we do one-on-one with the nuclear attending that's on. So we get really good feedback and kind of get used to working closely with the attendings and how they're interpreting everything. And we have a really robust experience, kind of as I was talking about, and all of our fellows are able to sit for the nuclear boards, and we don't need to do any additional kind of courses or anything beyond the training that we're able to get here in Hartford. So it's a really wonderful experience, a really educational experience. Overall, a really strong nuclear lab here at Hartford.
In addition to bedside learning, we also have a formal structured didactic schedule. This includes daily conferences, weekly grand rounds, monthly morbidity and mortality conferences, as well as opportunities for the fellows to present cases on a regular basis. During the COVID-19 pandemic, we transitioned from a full in-person experience to initially a virtual only experience for our conferences, and now we use virtual meetings to have all of our conferences to allow the maximum amount of fellows to participate, even when they may be on a busy consult service. We have found that this hybrid experience has increased attendance both on the fellows and faculty part and has enhanced our learning experience. Here you can see a video of our call room. It's a typical call room you'd see in any hospital, with a computer and telephone in the room to answer any pages or write orders as needed. In addition, we have several food options at the hospital. There's a cafeteria open during the day. There is also a 24-hour Aubon pan within the main lobby of the hospital. In addition, there is a Starbucks and several other restaurants within walking distance of the hospital, which are open during normal business hours. During the summer months, several food trucks gather in front of our hospital as well. We hope that you enjoyed this short video that highlights what makes Hartford Hospital such a great place to train. We enjoyed meeting you on your interview day and look forward to seeing you hopefully one day soon in person.